In 1964, Perth was a young but expanding city where the hustle and bustle of a busy St George's Terrace, a day at the beach, or just seeing someone off at Perth Airport made for a family day out. The change from sterling to decimal currency, an obvious reminder from the era. On the eastern seaboard, in particular in New South Wales, asthma foundations were being established through the efforts of the late Mickey Hardy. And it wasn't long before the push stretched across the Nullarbor to be recognised by Judith Barton, who's regarded as the founder of the Asthma Foundation of Western Australia.
Well, I remember her being very excited when she was approached by these women from New South Wales. And having two healthy children of her own, she felt it was a lovely opportunity to help those that have problems.
Mrs. Judy Barton was absolutely pivotal in even establishing the place, and was just the engine room, really, you might say, and for many years, and she was outstanding.
You've got to give credit to her to getting things off the ground. It's always the hardest thing to start any organisation from square one.
The first recorded meeting occurred on the 6th of July 1964, coordinated by Judith, with her father, Sir Lance Brisbane, the inaugural president. The meeting lasted 30 minutes and was held in the offices of Brisbane and Wonderlick.
Its dedication in those days was to promote and fund asthma research. There was no asthma research at all in WA.
For my mother, charity really meant charity. She was not prepared to have any of the donations spent on anything else but the foundation's research and work.
First batch of money went to establish or help establish the Department of Clinical Immunology up at Princess Margaret Hospital.
Dr. Kevin Turner was enticed from Adelaide to come and join the foundation.
Recruiting Kevin Turner, that was the first and major innovation that the foundation set about doing when it established.
It was actually January the 25th at 1:30 in the morning. I know that clearly because there was a howling hot breeze across the tarmac, and I thought we've gone to hell.
Shortly after Kevin Turner arrived, I remember he and his wife Faye coming to my mother's home. She treasured having Dr. Kevin Turner in Perth.
Kevin Turner, with his work at the immunology, put the place on the map, really.
Working out the mechanisms of asthma, what triggered asthma, where it was prevalent and so on, was dependent on the creation of the unit, which was done by support from the Asthma Foundation of Western Australia.
This was at a time when we didn't have a lot of good drugs to treat asthmatics. Parents were often afraid to allow children to be away from home because they might get asthma at night, as they're prone to do. And so it was a big thing for these children to be able to go down to the first camp, which Mrs. June Steen-Olsen was the major organiser with Dr. John Hobdane.
It was fantastic, the number of people who helped.
Volunteers to run the camps. We had doctors and asthma staff, nurses and so on. So it was all very professionally organised, and it was well received by the public.
In 1973, I decided we'd have a look at a study to see if asthma was really benefited by swimming. And so I got a grant from the National Health and Medical Research Council to look at this.
The first 10 years sought to educate asthmatics and the medical profession of the necessity for a coordinated approach to control asthma. Providing research facilities for the treatment and rehabilitation of asthmatics was the next big challenge. We now had a respiratory research program in WA. Our asthma camps are being established and an Albany branch was formed. The question was also being asked whether swimming would prove to be the breakthrough in managing the disease.